There have been many legal cases that have changed the course of history, and for educational law, one of the biggest was Brown v. Board of Education in 1954. This case decided that racial segregation was unconstitutional and opened the door and would allow for many special education needs to be met in the future. Then came the Elementary and Secondary Education Act of 1965, which created a Bureau of Education for the Handicapped. Although educating students with disabilities was still not mandated by federal or state law, this creation of a bureau signified that many changes were coming. Here you see President Johnson at the signing ceremony with his childhood school teacher. 1990 was a big year where the Americans with Disabilities Act was enacted. The ADA adopted the 504 regulations as part of the statute. In turn, numerous 504 plans for individual students started to become more common. Also in 1990, the Education for All Handicapped Children Act was amended and would now be called the Individuals with Disabilities Education Act. IDEA is the law that provides many benefits and protections to every eligible child who has a disability and to his or her parents. The major purpose of IDEA is to make a free, appropriate public education, FAPE, available to every child who has a disability. Now let's talk about autism. According to IDEA and the MDE guidelines, the autism categorical label is assigned to children who demonstrate behaviors 1. Atypical for their developmental level, 2. In at least 2 of the 3 core features of autism spectrum disorder, social, communication, restrictive, repetitive, and or stereotyped patterns of behavior, as determined by the multiple sources in multiple settings, and 3. That adversely affect educational performance. We also know that autism spectrum disorder is the most rapidly growing developmental disability, ranked as the 6th most commonly classified disability in the United States, and it is estimated to currently affect 1 in 110 children. With the prevalence of autism growing in the United States, let's listen to Ami Khan in his TED talk about the benefits of early intervention for autism spectrum disorder.
Itself, as they diverge in that pathway of learning that I mentioned to you. Were we to be able to identify this condition at an earlier point and intervene and treat, I can tell you, and this has been probably something that has changed my life in the past 10 years, this notion that we can absolutely attenuate this condition. Also, we have a window of opportunity because the brain is malleable for just so long. And that window of opportunity happens in the first 3 years of life. It's not that that window closes. It doesn't. But it diminishes considerably. And yet, the median age of diagnosis in this country is still about 5 years. And in disadvantaged populations, the populations that don't have access to clinical services, rural populations, minorities, the age of diagnosis is later still, which is almost as if I were to tell you that we are condemning those communities to have individuals with autism whose condition is going to be more severe. So I feel that we have a bioethical imperative. The science is there, but no science is of relevance if it doesn't have an impact on the community. And we just can't afford that missed opportunity because children with autism become adults with autism. And we feel that those things that we can do for these children, for those families early on, will have lifetime consequences for the child, for the family, and for the community at large.
So if we know the positive benefits for early intervention and diagnosis for ASD, the real question is, are all students being diagnosed early and are interventions being taken? Sadly, the answer is no. Mandel and colleagues found that European American children were diagnosed with autism earlier than African American children by an average of 16 months. Due to this difference in age diagnoses, diverse students may not be receiving the intensive early interventions during the critical time period in which the greatest likelihood for positive impact exists. Research has indicated sobering racial disparities in the early detection and treatment of ASD, with children from minority groups often diagnosed at later ages than their white counterparts. Medically based research indicating that racially diverse students are being identified with ASD at later ages or are potentially being misidentified entirely. Research has shown that diverse students are not getting early intervention because they are not getting diagnosed at the same rate as their white counterparts. With this, the disproportionate representation of culturally and linguistically diverse learners in special education has been identified as a critical challenge facing educators. Now that we know there is disproportionate representation in autism spectrum disorder, where do we go from here? As a special education teacher, this means that we need to make sure that all students are treated with equity, not equality. To make sure educators feel prepared to meet the needs of ASD students, there should be specialized training and teaching strategies to enhance the academic engagement and behavior of ASD students. Once educated, there are many things that we as ASD teachers can do for our students by using communication devices, visual schedules, voice augmenting devices. There's tons of different tools we can use. Along with these tools, teachers can be culturally sensitive. They can forge relationships between families and teachers to facilitate accurate identification of culturally and linguistically diverse students for ASD. Many families from culturally diverse backgrounds underuse school-based services. We can also select textbooks, design bulletin boards, and present lessons that are culturally supportive of students, thus closing the gap. All of this research points to the need for improved early screening and detection practices targeting racially and linguistically diverse groups, as children from minority groups may be less likely to receive timely clinical diagnoses of ASD outside of the school setting. Their parents are potentially relying on special education screening and assessment for ASD identification. With all of these things standing in our way, let's do our part to bridge the gap.